Pain is a friend of ours that all of us want to get rid of, and yet we can't. And if we were, it would leave us very confused in our surroundings and ourselves. Pain serves a very important element in giving us signals of distress, whether it's a physical pain or emotional pain. It makes us aware of that something is not quite right. You rather know it than not, would you? Pain is actually a signal from our body that alerts our brain that something is not quite right. So, I happen to walk into my kitchen and looking at the wonderful food, and I happen to lift that little pot, and ouch, it hurts me. I accidentally put my fingers on a part of the pot that I shouldn't. It's hot, but then I pull my hand away. So it serves the purpose of getting me away from a painful area and a hot thing. So true emotionally. If I'm in a relationship, I'm in a difficult situation, when it hurts, I might as well say ouch and walk away from that situation. So pain serves many wonderful purposes, and yet we don't want to keep it around us.
I have personally experienced pain in my life. I can remember being younger, and I was doing something, I think walking around, and the next thing I knew I was on the floor and my kneecap was on the side of my knee. So, that was some pretty intense pain. And I remember feeling that. I can remember that to this day, so it made that impression in my mind. I also have several family members that have been through extreme painful situations that have led to surgeries for both of them. So as a family member, sitting back watching somebody I love go through that pain was hard too, because they're not the person you know normally, because their pain has affected them so much, so it's hard to sit on the other end as well. So I think being in both situations, it's difficult. Pain, if it's physical pain, we oftentimes can't do things that we normally do, just regular daily activities. I mean, even if you think of a common cold, that can really affect you for a few days or even a week or so. So that really affects us, something simple as that. And then if we multiply that by 100, if we're living with intense pain, we really just can't do the things that we're used to doing. Therefore, we can become very emotionally affected by that, even extremely worried and anxious or even depressed, because we just cannot do what we are used to being able to do on top of feeling that physical pain. So it's pretty intense.
Short-term pain is wonderfully remarkable. It alerts us, I'm playing soccer, I got hurt, I stop my game, I attend to my body, I listen to my body, and more often than not, most of the short-term pains gradually go away. We get some treatment, doctors, ourselves, Tylenol, whatever we might be able to take, but it just serves the purpose of allowing us to listen to our bodies, attend to its needs, and then letting it go. Now, if it's a pain that's lasting us for many days and months and years, that really becomes a very different entity by itself. Living with chronic pain is no fun. And there are much different ways to cope with that than just a short-term pain. People do, as all of us do, what we can find to do. And that could be anything. It could be a number of things, such as drinking alcohol, using some drugs, or using some medications, which are prescription medications. Trying to find relief by turning to food, which is always around us and within us in some shape and form, and also kind of trying to find ways to, sometimes we try to run away from pain, but we get to places where the pain is with us all the time, isolating and withdrawing from others, and also compulsive shopping. There's just to name few.
Also, I think that with chronic long-term pain, I think that the pain begins to define the person spiritually, emotionally, and physically. And I'm pretty sure I'm safe by saying that if we were to define pain, we wouldn't define it as a pleasurable or enjoyable or happy experience. Therefore, what I'm seeing in the clinical setting are people suffering with depression and sadness, anger and resentment, fear of not being able to maintain healthy relationships with their family, their friends, their significant other, able to maintain employment. With that said comes additional stress and worries and fear, People begin to drink, abuse substances, isolate or withdraw, unable to maintain any normalcy, so to speak. And we can't forget those sleepless nights. Anybody suffering with pain will, first thing they say is those sleepless nights. I feel that people are doing the best that they know of. So if it's working, if they're seeing their therapist, or they're seeing a chiropractor or physical therapy, and they're on medication that is effective, then I think that's wonderful. If they are abusing substances or unable to maintain relationships, and it's ineffective, then they need to engage in other forms of coping. Such as breathing and meditation. That's what we do at Seclair is a unique form of treatment, teaching people how to utilize those coping skills, breathing and inner peace and spirituality.
The scientific discoveries are phenomenal. We know a lot more about corrective action, depending upon the physical challenges and others. There are a lot of things. There could be surgical procedures, there could be medical procedures and other treatments, which can be a combination of various physical rehabilitation, which can be very effective and very helpful. And healing, we need time to heal, and our body has a remarkable ability to find that inner strength when it's called upon to do that. So most people do very well when pain strikes them and they're able to work their way out of it. That really becomes a very different way of living, and it really affects one's life all the way around. It's not only work, but the social sphere of our life and our sleeping sphere of our life. So with that said, dealing with chronic pain is a very difficult task, but a very wonderful potential.
We see patients ranging from willing and ready to do whatever it takes to find temporary relief, to patients who are very resistant, feeling like they've tried and done everything and still have not found that relief. So with long-term chronic pain, like Dr. Chaudhary had mentioned, is very, very difficult. It's very time-consuming and debilitating and very stressful in many ways.
The threshold goes down for pain because we have our body faculties which are very strong and fighting simple pains. But over a period of time, it's very exhausting. So we have some interneurons in our brain, in our body, in our spinal cord, and our nervous system, and we create our own opioids in our body. They all are at our service, but after a while, they're done. They don't know what else to do. So we are depleted of our inner potential resources to cope with the long-term pain.